started here. And Robin, just so you know, if you have a presentation, I have multiple shares, so you can share your screen if you got that. So, but I will pull up ours. Stop.
Okay.
Stop. 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 Come on.
Yep, I'm ready when you are, Karen. So,
I'm a coming. It's right.
okay. Well, welcome everybody, and well, kind of welcome back for me. So I've been was out of pocket the last couple weeks, so I appreciate Kent and Katie and Karen for stepping up in my absence and keeping this train on the tracks. So I think all that says is you don't need me. So no, never mind. Just kidding. But I'm excited to be back and certainly watching a little bit of basketball. But we'll get to that in a moment. So let's go ahead and start as we do every week and lead off our meetings with the Pledge of Allegiance. So please join me if you can, or you can stay on mute. That's fine. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And as we do, we certainly put a call out to see if there's anyone in our Rotary family that we should keep in our thoughts this week. So if you know of anyone, please speak up. Be sure to unmute. Okay. Not hearing anything, we'll keep moving along. Just thought it would be interesting that I always kind of try to throw this in once a month, but this day in history. So in 1965, Martin Luther King Jr. and other civil rights activists completed their march from Selma to Montgomery, Alabama on this day in 1965. So, and as everybody knows, I'm sure you're probably aware the NCAA tournament is underway, men's and women's. Iowa certainly took care of business in round one against Holy Cross, and I think they're playing West Virginia tonight. Should be maybe a better matchup than the one they got in the first round. Iowa State men started off pretty poorly, about as bad as you can in that game against Washington State. But as they're wont to do, their defense is stout, and the shots started finally falling, and now they're on to the Sweet 16 in Boston against what will probably be an extremely tough matchup in Illinois. They can really shoot it. But happy to see them moving along. And as we were talking, the Iowa State women, if you stayed up last night, which we did, so probably the bags under the eyes probably show that late night, but boy, what an effort they put in and just came up short in overtime. So pretty good postseason so far. So, and I think the Iowa men might have lost in the NIT on the road. So no brackets are there's no perfect brackets yet, and I was interested to kind of maybe look up some of the odds of picking a perfect bracket, and it's a pretty small chance that you would ever be able to pick one. And it's some of these numbers here are a little hard for me to even articulate. So I'll just kind of go with the easy one. Like 1 in 9 quintillion if you just guess or flip a coin, and 1 in 120 billion if you know a little bit about basketball. I'm not exactly, this is off the NCAA website, so I'm not exactly sure how they come up with calculate all of these. But it's a pretty interesting when you look at it that as of 2015, and then I'll move off this topic. But the best estimates for the number of trees on the planet was 3 trillion. So imagine that there was one single acorn hidden in one of those 3 trillion trees, and you were tasked with finding it on the first guess. Your odds of success are approximately 3 million times greater than picking a perfect bracket. So keep filling them out. I didn't fill one out this year. I just wanted to sit back and enjoy for once. But it's always a little bit of fun and makes for good fodder, water cooler talk or whatnot. But your odds of picking that are pretty much next to impossible. So anyways, I don't know that we have any other business for today, Karen. No. All right. Well, then I think we can. Is Katie on to introduce our guest speaker? Yeah. As always, folks, if you have questions, don't save them to the end. Please drop them in the chat feature, and or wait to the end if you want to raise your hand, unless Robin certainly makes some room for Q&A along the way. But put them in the chat, and we'll address them either as we go or at the end. And I'll hand it over to Katie.
Thanks, Mason. Morning, everyone. Today we have Robin McKee from CICS joining us. And just a little background on CICS, they support individuals and strengthens communities by serving the unique needs of people with brain health challenges and intellectual and other developmental disabilities in 15 counties in the state of Iowa. So Robin has held various social work and community service positions throughout the years. So please help me welcome Robin McKee. Thanks for being here, Robin.
Thank you. Thank you. So CICS stands for Central Iowa Community Services. We're kind of right in the middle of the state with our 15 counties. I will share some of the services that we provide within the region and some of the services that we help individuals link with. And then I will gladly answer any questions for anyone. Some of the services that we do provide for any individuals include, we have helped fund a crisis line and mobile crisis here in our region. The crisis line is 988. It goes into Foundation 2, and then they dispatch out mobile crisis, and we contract with Irely Ball for that service. And that goes out to individuals in the community that are experiencing any type of crisis and feel that they need an in-person person to come and help them navigate that. Through that, then, we do provide crisis stabilization services residentially for children and adults. Children, we contract with some of the shelters within the state of Iowa. Youth and Shelter Services has 2 sites in our region, in Mason City and in Ames. We also work with Youth Shelter Care of North Central Iowa out of Fort Dodge. And we do have a contract with Easter Seals. Those crisis stabilization services for children can last anywhere from 5 to 14 days. At that time, during that time, the agency that the children and families are working with try to surround them with community supports and return them to their home as soon as possible. We also have residential crisis stabilization services for adults, and we have contracts with a number of different facilities within the state of Iowa that we work with. We do work with Mary Greeley on some subacute services, which is a step down service from needing an inpatient behavioral health unit. The next service that we have that I consider kind of a crisis service is every hospital within our region, other than Mercy One out of Mason City, because they have a behavioral health unit on site. We fund ITP services, which are integrated telehealth services, psychiatric services that can be accessed through our local ERs. And so people experiencing a crisis can also go to the ER and then be seen through telehealth to a psychiatrist that could help make some recommendations to determine whether or not they needed to go to an inpatient behavioral health unit
or can work on some outpatient services. We have service coordinators in all 15 counties within our region that help individuals link with mental health services, and possibly, depending on that service and the individual's insurance and income, we can fund some of those services. Many services include the outpatient individual counseling and medication management that we work with individuals to help them set those appointments up and navigate that system. In those appointments, we often help individuals apply for Medicaid to assist them with funding long-term services. Some of the services that we work with adults with an identified disability are community living supports and also employment services. And we work with local agencies on funding those services short-term, while again, we are assisting the clients with getting on Medicaid so that they can work with a Medicaid case manager. In some of our communities, not all 15 of our communities, but a good majority of them, we also have adult community drop-in centers where individuals can go during the day. They might be able to use a computer to apply for services. There are some daily activities that sometimes the drop-in centers offer, and it is a place just to relax and socialize with others. We also recently have justice-involved service coordinators that work within our jails and assist with local police departments and sheriff's departments on working with individuals that possibly struggle with going in and out of jail, that maybe need linking with some mental health services that then, and housing, so that then they would be able to have a little bit more stability. I see one question is that children, yes, children is identified as anyone under the age of 18. Our crisis residential stabilization services pretty much go for kids 8 years and up. Easter Seals will serve children 5 years and up. One of the other services that we do have through mobile crisis is community-based crisis stabilization services. So that would be, I'm in crisis, I need some pretty intense services right now, but I don't want to go residentially with outside of my community. And mobile crisis through Irely Ball, they can work with individuals and help them do some assessments, possibly some short-term medication management. Again, the whole goal is to link people to those community services and supports. We do have some very short-term rental assistance that we do work with individuals on, but they have to be engaged in some other longer term, what we consider adult services, such as being involved with supported community living or employment services prior to assisting with that. We link a number of people with local agencies if they're coming in for rent. We do work with people on, again, completing low-income housing applications. We do a lot with helping people call and reach out to Social Security and to Health and Human Services about their benefits that they qualify for or want to apply for, or possibly have all of a sudden become ineligible for the Medicaid or food stamps through Health and Human Services, and they're not quite understanding that. And we work with them on that. now I've thrown a lot of information at you in a short amount of time. So really, I open it up to any questions that you might have about those services. As you're aware, we do work closely with Youth and Shelter Services, Optime, REM, 43 North Iowa. We work closely with Vocational Rehabilitation Services. I know I'm going to miss some providers. Irely Ball. Yeah, a number of individual provider agencies that we work with to surround those clients to be as successful in the community as they can be.
Is there any connectivity with Iowa State University?
We do work with, we get a number of applications for like ongoing linking with individual counseling, mental health counseling, primarily with those students. We do work with some if they're looking for some employment services, if they've been linked with voc rehab first.
Robin, did you talk about your kind of sources of funding?
So our sources of funding are from the state currently, and then we work with people to, again, how fast can we get an individual onto Medicaid? Because Medicaid is the long-term funder for supported community living services, for employment services, individual counseling and medication management. Of course, if someone is uninsured, we help them with applying for Medicaid. We also work with families if they have insurance, but maybe their copay is more than they can handle. We do a sliding fee scale for mental health services and medication management with families and children to help link that so that they can continue with those services. We recently also have started funding behavioral health intervention services, which is kind of a combo of individual counseling and family therapy for families. Traditionally, that service was only funded through straight Medicaid, they call it. And so if you were a family that your children were on Hawkeye, or if you have private insurance, you could not access that service. And so now we have worked with families and we can help fund that on a sliding fee scale for families so that they can have that service. Again, all of the services that we work on are trying to help individuals and families just be as successful as they can be in their own communities and in their own homes. We do a lot of, I see a question, how many cases? We do a lot of short-term funding because again, we're linking people to that longer-term Medicaid. So roughly 15 to 20 cases per worker probably at a time. We struggle a lot with people finding safe, affordable housing. And so that is what we deal with a lot. People come in, we're trying to help them with housing and trying to get them in a safe, stable environment so that then they can access other services. So a question is, are there services available for immigrants unable to work legally or those who later have work but problems with housing and other supports? So we follow the same guidelines as HHS. And if you are in the United States legally, have a work permit, have a resident visa, then we would be able to work with you. If you're undocumented, we are not able to provide services. And that's straight from the direction of Health and Human Services, who now give us all of our funding. I think what are the most prevalent mental health services needed for our clients? Individual therapy. I think we have a lot of kids that are struggling with needing therapy. And we have quite a waiting list in some of our areas, depending on what age group you're looking for therapy. And so we do have some schools that have therapy right in the schools. We try to keep a list of agencies that have openings so that we can refer families to those services. Ooh. What percentage of folks in our community would be considered vulnerable? Steve, that's a hard question to answer. I think the hard question for me to answer that is we typically, we deal with a number of different clients. I don't know percentage-wise, if you looked at population, how we would, figure out what that percentage would be. I think on any given day, lots of people are vulnerable depending on what their mood is, what their financial status is. So we are working with people all the time. We don't have a waiting list for our funding at CICS currently, but we gap fund. It is taking a very long time for individuals to process their Medicaid applications through Health and Human Services. Used to be 35 days. It is really going more towards 45 to 60 days. Then when you look at waiver services, which currently we have 7 waivers that work with individuals with an identified disability within those waiver groups. Some of those waiver groups, like the brain injury waiver, the intellectual disability waiver, that provide those community supports and services, the waiting lists are years long. We have clients that have been on those waiting lists for 5+ years. Health and Human Services is currently revamping those waiver services. So if you hear in the news, the acronym is HOME now, and it is talking about the community waivers and how they are going to redo those hopefully by July 1 of this year. That is a good question about how will any possible federal budget shutdown affect your program. I'm not really sure. I work with the service coordinators. That is a good question that would probably be for some of the other individuals on our leadership team. We do get state money, and so I'm sure that it will affect us because HHS gets federal money, so it will be a trickle-down effect if the federal government shuts down. I know that that will affect Voc Rehab because all of their money is federal money, so it will affect us somehow, just not sure what that would look like. I think our main issue that we work with many times with all of our what we consider our general service coordinators and our justice involved service coordinators is unfortunately the affordable, decent housing within all of our communities. That one is pretty much evenly spread out through all 15 counties. We just do not have enough housing that people can get into, and we struggle with that. The shelters are full, and we do try to, work with individuals and try to build those relationships that we can help them apply for that Section 8 housing and get that moving through. What path took me into this work? I think it was just a general transition into this. I started working at Bremwood when I was right out of college, and then worked at HHS for a number of years as a family and children worker, and then in 2002 got into disability work and really enjoyed this these services and working with the families that we're working with. Some of the first steps to reach out to counselors, typically we work with individuals that are looking for individual counseling, and then we let them choose which agencies that they're wanting to work with on that one. So Polk, Dallas, and Guthrie counties are in different regions. Polk County currently is its own region, and Dallas and Guthrie are Heart of Iowa region. So there is no particular reason why they're not involved. They are involved. They do some of the similar services that we do that I'm explaining to you right now within their regions, and their agencies their clients living in those regions can reach out to their offices. And that was chosen a long time ago. In 2013 is when the regions were first formed. We have moved more and more into children's services, I think. And that's probably been the biggest expansion, and working with them and trying to offer services to families. I think you, as working at and being involved in the Rotary Club, just good information and referral as you are out in the communities and you know of people that possibly might be struggling with accessing mental health services, being able to know where our offices are, and that we do have an office in each county within our region so that you can link people to the right door. And then we take it from there.
Where are your offices?
So we have offices in Boone County, Cerro Gordo County, Franklin County, Greene County, Hamilton County, Hancock County, Hardin County, Jasper County, Madison, Marshall, Poweshiek, of course, right there in Story, Warren, Webster, and Wright County. Our website is CICSMHDS.org, and that gives all the physical addresses of where our offices are. It also gives a picture and an email and phone for each one of our general service coordinators and our justice involved service coordinators. And we have 2 crisis coordinators, one adult crisis coordinator that works with the subacute unit at Mary Greeley on moving people back into the community. And then our children's crisis network coordinator works with individuals that are using children's crisis stabilization services, and again, trying to link them with longer term community services. And our application is online. If anyone ever wanted to apply for services, they can apply online and then submit that right through our website. And it gets to the right county.
Great. Are there any more questions for Robin? Okay, I'm not hearing any. Robin, great information presentation. We certainly appreciate what you do in all of the counties, but specifically within Story County and the services that your organization provides. So thank you for being with us today. And we'll certainly, this mental health is a key focus area, strategic focus area for Rotary. The Rotary year, which started last July and runs through June. And so it's definitely been a focus of our group and membership and Ames and we still have a few months left of my term, so I'm going to continue to bang the drum and do what I can to help get the word out there and break down some of those walls. And so your presence here today and your presentation is helping in that. So we thank you very much.
You are welcome.
Okay. All right. Katie, again, thank you for helping line up our speaker today. It was very appreciate your efforts. Karen, is there anything else that I've missed on the docket for today? Okay. All right. Well, very good. I might ask if we have board members on the line. Hopefully we have enough for a quorum, but if we have board members on the line, Karen, do we want them to just hang on to this line or start the other meeting? I know we have two separate meetings, but curious what the best way to do that is for you. You're on mute.
Let's start it on a separate meeting.
Okay, sounds good. All right, very good.
Give everybody about 10-minute break, and then we'll start about 12:45.
Okay, sounds good. Well, again, thank you, Robin. Thanks everybody for joining us. Good to see you virtually, of course, but back in the thick of things. So with that, we'll go ahead and close our online meeting today with the 4-way test with all the things that we think, say, or do. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? Thank you. Have a great day. Go forth and do great things. Take care.